All right, answering additional questions from our web portal. One of the questions is, what tests are required before the surgery? It all depends on the extent of the surgery. If the surgery is performed for the stage 1 and is done in a local fashion, which I don't advise, but people still do it, usually you need to have hemoglobin checked, which is usually complete blood counts, or known as CBC. The second test we suggest is BMP, which is Basic Metabolic Panel, which looks at your nutrition, at your electrolytes, sugars, and so forth. Considering that a lot of patients have also issues associated with their thyroid, we also recommend TSH. Also would like to have patient tests for hemoglobin A1c, just to determine their ability to heal. If you have more advanced stages, or if you're a little bit more overweight, then we also need to look at the nutrition, at the protein levels. So BMP will show us some of it. Also, hospitals usually require blood clotting tests as well as pregnancy tests. That's a standard blood test that are required. Cardiogram is usually required for the patients over 40, especially with heart issues, and chest x-ray is usually required for most patients over 40 or 45, or earlier if they have history of smoking or any other lung issues. And that's kind of the basic blood work tests that are required. Lately, what we do is we also make sure that we get your nutritional panel assessed, because we sometimes see the patients, especially going on Ozempic, losing weight, they're feeling better, looking better, but they're deficient from the standpoint of proteins, because on Ozempic or other CLPs, you need to continue with a high protein diet, and the patients that do not have their protein drop precipitously, and as a result they're not able to heal not only lipedema surgery but other surgeries. So that's why for the patients on any kind of diet modifications, we need to make sure that your protein levels are in place. If they're low, what happens is that your blood oncotic pressure, which is the pressure of protein inside of the bloodstream, goes down, and your body cannot hold fluid inside of the blood vessels, and it leaks out into the subcutaneous tissues, creating more drainage, more swelling, and more challenging recovery. So that's about that.